আসছে না আরে দাদা আরে দাদা আমি প্রুফ সিলেক্ট করা হয় ওই জন্য আসছে ঠিক ছিল ওকে সরি ফর দ্য ডিলে
No, you have to go to docs. Chinmata, docs, not view. It is not required. Docs, yes. Now stop sources, yes. Fine.
Okay, so you all can see it, no, and hear me nicely.
Yes, sir.
Okay.
We can see the screen and hear you as well.
Okay, so I'm starting scanning from the posterior midline, and how you can see here is your occiput, and when I'm coming down you can see what I was telling you, that this is your trapezius, very thin layer of trapezius. This is your trapezius. Sorry, annotation. So this is your thin layer of trapezius, and then I am coming down. Let me increase the depth again a little bit. Okay, so I'm starting from here, occiput, and then I'm coming down. The semispinalis muscle has started. And at this point, this is the curved without a spinous process is your first rib. Again, I am showing you, or not, I phrased it at a wrong position. So the first rib don't have a spinous process, so it will be rounded. Not first rib, sorry. I'm talking first rib. Sion, arch, lamina. Okay, here. Okay. So this is your C1. Just I have freezed a little bit just down. So here what is important is we will not be able to see the spinous process, which is there, which will be coming down at the C2 level. So if I'm coming down, occiput, then comes, this is C1, this is C1, and then the C2 is coming, and C2 will be having the bifid spinous process. So this is your C2. This is your C2. So now if you are looking about the muscles, what we can see here. So at this area, okay, let me freeze it here. So the hot muscles we can see here is this is your trapezius. This is your semispinalis, medial part, medial fascicles. This is your semispinalis lateral fascicles. Then this is the rectus capitis, your posterior minor, and this is your rectus capitis posterior major. Rectus capitis posterior major is your little bit lateral to that of the rectus capitis posterior minor. Again, so from here, the occiput, then if you are coming little bit deep, will be coming this one, and then this is C1, And then when coming down, we'll be able to see the bifid spinous process here, the bifid spinous process, and this is your C2. So at this point, if we are going laterally from the C1, C2 junction or C2, if I am going laterally, you can see whole of this is your the semispinalis. Whole of this is your semispinalis, and I am in between the C1 at the level of the C1. So this is your semispinalis. Sorry, this is your whole is semispinalis. This is your rectus capitis posterior minor, and this is your rectus capitis posterior major. And then I was at this level, and now I am coming more down at the level. Okay, before that, at this level, let me go laterally and see what else we can see. So when we are going laterally, these muscles which is appearing, you see, on the top above the semispinalis muscle is your splenius capitis. If I'm going laterally, this is your splenius capitis, and below that I'm freezing. So here, what you can see here is your this was your semispinalis capitis, and that above that this was your the splenius capitis, and this is your longissimus capitis. Went into sleep mode. Okay, so what I was showing here at this point, this was C2. Just above that, C2, above that, we can see the rectus capitis posterior minor and major. And at this level, if I'm going laterally, this whole bulk is your semispinalis. And if I'm still going laterally, on the lateral side, we can see the splenius capitis, and below the splenius capitis, below the splenius capitis is your below the splenius capitis. This was your splenius capitis. Whole is your splenius capitis, and below that is your longissimus, and this was your semispinalis capitis. You can see part of it, and above that one muscle has started appearing is your sternocleidomastoid. I just told you here the sternocleidomastoid is like a strap muscle at this level. Okay, so now if we are looking at this level, just lateral to the sternocleidomastoid, we'll be able to see the lesser occipital nerve. Let me search lesser occipital nerve at this point. Just medial border of the sternocleidomastoid. So again, this was your, the top muscle is your the trapezius, thin layer, and below that is your semispinalis capitis. If I'm going laterally, you can see the splenius capitis, below the longissimus, and you can see this lateral side, the muscle, this muscle is your, and you can see the nerve there. Okay, so here উপরে তুলতে হবে, না উপরে তুলতে হবে, এই ঢাকা পড়ে গেছে এখানে। Okay, so this is your sternocleidomastoid. Again, what are the muscles you can see here? This is your splenius capitis. This is your longissimus. This was your splenius. And here you can see is your lesser occipital. So here again, the above-most, the black strap muscle is your strap-like muscles is your trapezius. If I'm going laterally, so this is your the splenius capitis, above that sternocleidomastoid, and you can see the here you can see the just medial to that is your the lesser occipital. And lesser occipital, if I'm coming down, just lesser occipital nerve is just below my white arrow. Is a round shaped.
So please clear the annotations.
Sorry. Okay, so here is the lesser occipital nerve, and normally the lesser occipital nerve, it curves around, it comes between the below the, as I told you, sorry. So it comes on the posterior border of the sternocleidomastoid and it goes above. So now I'll be just coming little below. Let me increase the depth a little bit. Okay, so I am at the level of the C2 now. So at the level of the C2, if I'm going laterally, so now what muscle you can see at the level of the C2? Because the rectus capitis posterior major muscle you cannot see here because it is already inserted into the spine of the C2. So here if you are going laterally, please correct. So what muscle you can see here? So here, this is the lamina. So this is your semispinalis capitis. This is your bifid spinous process, and this muscle is your obliquus capitis inferior. So now we have to find search in between these two facial layers, and it will be very nicely seen. When we are making it oblique, I'll be seeing this obliquus capitis inferior muscle both in long axis as well as in the short axis. Okay, so this is your C2. This is your C2. You can see the lamina very nicely, and I am coming there here on this side. You can see the obliquus capitis inferior. Now what I'll do, you see what I'm doing, look at my probe position. I'm just rotating my probe. It was initially like this. So now I'm rotating the probe like this. That means the lateral end of the probe, that means the aspect marker, I'm rotating towards the C1. See, I'm rotating like this. And in that way, I'll be able to see this obliquus, because if you are remembering, obliquus origin and insertion, so it is oriented like this. And now we can see the obliquus in a long axis. So in this way, I can see the obliquus in a long axis, and I can found the greater occipital nerve in between this semispinalis capitis and your. Okay, so this was C2, and we can see the obliquus above semispinalis, and above that is your trapezius. So what I am doing, I am tilting the probe. And you can see the greater occipital nerve in between the facial plane. Just in the middle of my screen, just round shaped, which is going up and down when I'm tilting the probe. Can you appreciate that? I'm just I'm freezing it here. And then again, I'll be showing you. So this was look at this. And it is accompanied by a vessel. Lesser occipital is not accompanied by a vessel. So again, I'm holding the probe over the C2 and I'm tilting the probe like this. If I'm coming down, it basically it now wraps around the obliquus, the capitis inferior, and that is the reason why if I'm coming down, the nerve and the vessel comes laterally. You just follow these dotted things. You can see when I'm tilting the probe down, it is going laterally. When I'm moving the probe up, it is going medially. And I'm seeing this in the short axis. I'm seeing this in the short axis. And if you are looking about almost towards the midline, you can see another nerve. Just when you're moving, you just follow that nerve as well. That is that dot as well here. That is your third occipital nerve. So again, I'm unfreezing, and again you just look at these two dots and look at my probe position. So I am over the C2, and now I am going laterally, now tilting the probe, and at this position I am just moving up and down, and you can see this. The extension of the neck is important. So I'm coming down. I'm now seeing this obliquus. Now you can see very nicely, one dot here, and another dot here, this one. And now if I'm keeping that dot in the center, greater occipital nerve, and I can see the greater occipital nerve in the long axis as well. You see the greater occipital nerve, I'm tilting, look at my tilt, how I'm tilting the probe. I'm just making it opposite, and you'll be able to see the long line. See now this long line, and I'm just again tilting the probe. You see it is going medially, laterally. So this is your, and if I'm freezing it here, look at my probe position here. Okay, so now what I'm doing, I'm looking that I'm seeing here the two muscles here. Okay, you see the long axis now, medial side is your greater occipital, the third occipital nerve, that is also very nicely seen, just right side of my screen, and the greater, this is your third occipital nerve, and this is your the long axis, the greater occipital nerve. And again, so I was here, and here at the short axis, you see how I am holding the probe. Now I am perpendicular to the obliquus capitis inferior. So, and also I can see part of the okay. So here, this is your obliquus capitis inferior in the short axis, and this is part of your the rectus capitis major, rectus capitis posterior major. So both are seen in the short axis because both are little bit oblique. These are, this is more vertical. The obliquus capitis posterior major is more vertical, and obliquus capitis inferior oblique is more oblique. But at this angle, you see, if I'm holding the probe like this, I'm seeing it in a short axis, cross section. And when I'm tilting the probe like this, I can see the obliquus capitis inferior, that is your in the long axis. But at this point, I cannot see the obliquus the rectus capitis posterior major. At this, I cannot see the posterior major. But if I am tilting like this, then I can see the obliquus capitis posterior, because this part I have moved towards the C1. So when I'm going towards the C1, then I can see, because as I told you, the rectus capitis posterior major, it is inserted into the C2 spinous process. So when I am holding the probe over the C2 spinous process, I cannot see the rectus capitis posterior major. But when I'm tilting towards C1, I can see it nicely. And at this point, I can see the short axis of the obliquus capitis inferior as well. Okay. So let me clear the drawings and let me unfreeze. Okay, so we have seen the greater occipital, lesser occipital. Now I'll be showing the, so again, just for the, because the greater occipital nerve is one of the very important. So just and third occipital also. So again, so starting from occiput, then I'll be seeing over the C1, and then I'm coming the bifid spinous process. So at this point, I am at the level of the C2. And you see what is my probe. And now what I'm doing at this point, I'm tilting the probe, the lateral side of the probe towards the C1. And at this position, I can see, make a probe, tilt probe little bit here. And you can see the greater occipital nerve on the lateral side, the third occipital nerve on the medial side, and I can see the cross section and the long axis of the whole of the obliquus capitis fibers are very nicely seen. So this is, you can see the whole of the long axis of the obliquus capitis inferior. And if I'm tilting the probe like this, you see the muscles, now we are seeing the cross sections, and now you can see the two muscles cross sections. The medial one is your small one, is your rectus capitis posterior major, and the lateral one is your obliquus capitis inferior. And here you can see the long axis, the black line in between the facial plane is your long black line is your the greater occipital nerve, and on the medial side a smaller, not that long line, that is your third occipital nerve. Okay, so now we'll be looking about the branches of the superficial cervical plexus. The four nerves I'll be trying to identify. Two nerves are very nice. Another nerve is seen here. I forgot to mention at this area. Another important nerve is your spinal accessory nerve. So spinal accessory nerves comes below the sternocleidomastoid and go laterally under the trapezius. So here I'll be reducing the depth so that I can see the things very nicely, because all these nerves are very superficial. So what I am holding probe here, and I hope everybody can recognize what are the structures we can see here. You see, I'm repeatedly telling what are these structures. So here, this is your sternocleidomastoid. This is your splenius capitis. This is your longissimus capitis. This is your semispinalis capitis. Okay. So here, as you already told, that not nicely seen. It is, if I'm going above it, a little bit better seen. That is your the what? Lesser occipital nerve. And now I'll be coming little down at the mid position, and I'll be able to see. So you look at that, this sternocleidomastoid muscle. I'm keeping sternocleidomastoid muscles, the arrow there, little more gel. Okay, so see here you can see the greater occipital, lesser occipital nerve. Again, that home position at this to see the cervical plexus, superficial cervical plexus. And now I'm coming down. I'm coming down. The sternocleidomastoid muscle is moving, and longissimus, another muscle is now appearing. So this muscle is your levator scapulae muscle. And if I'm coming down, just below the sternocleidomastoid muscle is your levator scapulae muscles. So here, this muscle was the splenius capitis. This is the sternocleidomastoid muscles. This is your levator scapulae muscles, and here at this plane. So the upper part of this superficial cervical, it is between the sternocleidomastoid and the levator scapulae. And if you are coming down, it is between the scalene and the sternocleidomastoid muscle. So I'm clearing the drawings, and again I'm starting from there. See here you can see the lesser occipital nerve very nicely just below the yellow arrow. Two dots are seen. The opposite to the aspect marker is very nicely seen. And at this point, I am coming down. Just fix your eyes over the sternocleidomastoid, and you'll be able to see some of the nerves are coming down. See, some nerve is coming. Okay, let me put it here. Can you see the two nerves? One above the sternocleidomastoid, one below the sternocleidomastoid. Can everybody appreciate that? Below the sternocleidomastoid, basically you can see the three nerves. Stop karo. Okay, so you see this is your superficial cervical plexus. So you can see the different nerves. Which one is which one? Difficult to distinguish here, but I'll be stressing one by one. But here above that, this is your greater auricular nerve. Okay, so again look at those tiny structures, and look at this, whole of this. This is your sternocleidomastoid muscle. Look at these sternocleidomastoid muscles and look at these small tiny dots moving here and there. And first I'll be showing you the greater auricular, and then I'll be showing the other nerves one by one. Okay, look at again look at the patient position as well. My patient position is, patient is turning the head little bit on the other side, and I'm holding the probe in the middle of the sternocleidomastoid, and I'm moving up and down, and trying to identify all those fibers. So if I'm coming down, what I was telling, I can reduce the depth a little bit more so that you can appreciate it better. Let me make it. This is all these superficial cervical plexus nerves are very superficial, so it will be visible everything within 1.5 1 centimeter. So look at that, what I was telling. So you see one nerve is coming down. That is your, look at this nerve. Follow this nerve, which is exactly below just at the edge of the sternocleidomastoid. Can everybody appreciate that nerve? That nerve is coming below the sternocleidomastoid is the spinal axillary nerve. Follow these nerves. I'm keeping it exactly below at the center. So now it has come subcutaneous, and you see where it is going, and look at my probe position also. So now lateral side, the muscles which is appearing is your trapezius. Trapezius here is bulky. You can see the nerve now, and now it is going below the trapezius muscles. Freeze it. Okay, I hope everybody has followed this now. This is your spinal accessory nerve. So it comes other nerves. If you are telling, okay, why it is spinal accessory nerve, why it is not the supraclavicular nerve, the answer is the spinal accessory nerves comes below the trapezius. Other nerves remain subcutaneous. As it is going periphery, it is very superficial, not under the trapezius. So that is why this is your the spinal accessory nerve. Okay, let me again show you. So I was here. I was moving the probe here. I'm just very closely looking below the sternocleidomastoid. You can see now this was your spinal accessory nerve. Below the sternocleidomastoid, it is coming down, moving, coming superficial. I'm keeping the probe so that it is below the white arrow at the center of the screen. Just look at my probe. My probe is coming down, and you see trapezius is coming now. You see now it is going below trapezius. So this is your, I can trace it below. So it is going down. So this is your spinal accessory nerve. Again, I'm going up. Now it is going below the sternocleidomastoid. And now look at this greater auricular nerve. I am now putting my, in the center is the greater auricular nerve. You see, I am moving down the probe down. See. From here it is the brachial plexus. So it is going up, encircling the sternocleidomastoid. It is going up, what Dr. Kanchan told already. So it is going towards the ear anteriorly, and then it will be divided into two branches, and it will be going there. So here you can see, here again at the center of my screen, very nice, beautiful dots. I'm coming down. So here it is mixing up with the superficial cervical plexus. So now I'll be showing the other two nerves. So I have shown two nerves of the superficial cervical plexus. One was the lesser occipital, Another is your greater auricular. Apart from that, spinal axillary obviously is a cranial nerve. So now these two nerves are very tiny nerves. I'm trying to keep this in the focus exactly. Let me search again. I have to struggle a lot to find these two nerves. Okay, so so they are the two knobs. I hope you have followed it. It was initially coming below the sternocleidomastoid, and then it gradually became superficial. I'm showing you again. And when we'll be tracing, the one nerve will be coming a little bit laterally, posterolaterally, and another nerve will be going anteriorly. I'm just again showing. You just look at this here. So normally I'll be starting from the midpoint. That is the homing. Sorry, let me clear the annotation. So at the middle, I'll be starting. I'll be able to see the greater auricular nerve originating. Sorry. Okay, you can see the greater auricular nerve very nicely below the. So this is the greater auricular nerve coming in the superficial cervical plexus. So at these positions, these other two nerves are going up, and here at these three positions, if I am bringing my probe down, you can see these two nerves. I'm talking about the keep eye on these two nerves. So they will be going separated when I'll be moving the probe down. Okay, these two nerves just below my middle of my screen. And you see, look at these eyes, they are going separated. One will be going anterior, very superficial to the skin. I'm just following the clavicular branch first, coming superficial, going laterally, just below my screen, and look at my probe where I'm going, and it is going laterally towards the clavicle, and it gets divided branches. Still, I am following one of the branch there. So this is your, look at my probe where I am coming. So this is the supraclavicular branch. And the other one, again, let me start from here. So other one will be going here. Here there is two nerve. Other one, this is getting separated. And if I'm going, other one is going in the facial plane, coming superficial, just at the middle of my screen, and going more anteriorly. And below I are seeing the brachial plexus also. So this is the superficial cervical plexus and these four nerves. Now, another two things I'll be showing. I'll be increasing the depth a little bit. So, and I'll be showing one of the technique. I don't know whether it has been described in any book or not. So here, first, my aspect marker is towards the cranial side. So I am in the midline, spinous process, but spinous process is not very nicely seen in the linear probe. So I have to take the linear probe. Now I'm coming at this point, and pyramidian sagittal oblique view. So what you can see here is you can see the dura. You see, this was the lamina, and what I'm doing, I'm tilting a little bit. Let me find the best view for you. And you can see the anterior complex, posterior complex. So you can see the lamina and the interlaminar space as well. And please go. Okay. So what we can see here is these are the lamina. Here the lamina, and this is your ligamentum flavum, and this is your, so this is your posterior complex, this is your posterior dura, and you can see the serum beam is coming. So this area is your anterior complex, and here you see the laminar is almost flat, and my probe position also you have seen, it is paramedian, sagittal, oblique, like we do in the lumbar spine also. So I can show in the okay, can you see these things? So I was holding the probe here. So hold the probe here and making it oblique. So I'm like this. So in this area, I was seeing the lamina is a, the line, straight line almost, and in between we can see the ligamentum flavum and the posterior dura. Okay, so let me show you again. So you can see again the lamina, and in between the two lamina, you can see the ligamentum flavum and the posterior dura. And now I'm holding the probe now in the short axis, transverse axis. So now at this position, what you can see here, see, as already Kanchan has told, when you wish to see the facet joint, so facet joint is normally seen in this view. So please go on. So this is the classical way to see the facet joints. So here you can see that this is the joint. This is the joint, and this is the valley where we will be able to see the nerve. Again, here is the joint. So normally, things to remember that the joint in the cervical area is seen in the hills, and the nerves are seen in the valley. So when we are holding the probe, so from the laterally and little bit oblique. So I was going to see this view if I am holding it like this. See, I'm holding the probe. Look at my probe position. I'm holding like this, and you can see the median nerves also very nicely at the valley. At the valley, I can see the nerves. But what I'll be showing here now, there is another important. So here, this is very easy. Everybody know these things. You can see the facet joint nicely, and you can see the nerves nicely. So now, what I'm going to show. Sorry, let me clear the annotation again. So what I'm going to show, I'll be holding my probe like this. So if I'm holding the probe like this, what will happen? So this is the lamina. The medially will be having the elevated spinous process, and laterally there will be elevated articular pillar. You see, this is the area where I'm talking. Let me reduce the depth a little bit so that you can appreciate it nicely. So here you can see, what you can see is here, this is the lamina, and this is the spinous process, and this is the articular pillar. So medial branch is situated here. I am holding the probe posteriorly, and this is your multifidus muscle. This is your, what is this muscle? Semispinalis. This is the splenius capitis. This is your longissimus, and here will be the levator scapulae. So at this position, we can do the medial branches. You see here. So what is important here? You see, this is articular pillar. So what I have learned just now, that the facet joints are situated over the heel, over the top. So at this position, that is the joint position. Though we cannot see the joint in this angle, but if I am coming down, you see the heel is converted into valley. So it is now valley. So please So at this position, if my needle is coming like this, then I can do the RF. Because RF, you have to remember that RF should be coming posteriorly and slipping over it. Mostly we do it under the CM guidance, but this is another way by which we can do the radio frequency of these things. Because most of the the literature describes that the RF should be done if in this view what I have shown just now, and but this is one of the way what we can do. The most of the books describe like this. So this is the view where we can do the medial branch, and in this it is described. But the problem here is, in the long axis, very difficult because of the shoulder. I cannot put my needle because of the shoulder. And in the short axis, so recommendation is to short axis to the diagnostic block. But for the RF, some books technique like that. But what I am telling you, this is very easy. Put a probe over the lamina. Put the probe over the lamina. So left side of my screen towards the aspect marker is your articular pillar. Right side of my screen is your sinus process. And now just move up and down. If you are moving up and down, you will be able to see that if you are moving up and down, you'll be able to see the valley is converted into the hill. Here it is the valley. Again, here it is a hill. Here it is valley. Here it is hill. So hill has a joint, valley medial branch. This is the rule. Remember it. So this way we can do the medial branch block as well. Yes, that is the medial branch. Even the medial branch is also seen. So we can see the medial branch here. We can see the medial branch here. So needle might be coming like this, and you can have the very nice target of which you can do under the tunnel vision. Okay, so this much. If you wish to repeat any of these demonstrations, you can ask me. I can demonstrate it again.
Sir, can I just add on one thing?
Yes, yes.
Actually, sir, when you were showing in the sagittal axis,